Have you recently got your teeth cleaned, and could you use a dental policy for the year 2026? Hi, I'm Tommy at medicalinsuranceday.com. So to talk about dental insurance, we're in the renewal period and everybody's adding dental for the upcoming year. And we have the single best PPO dental plan that's out there on the market to offer, hands down, bar none. So to talk about dental a little bit, most true PPO dental insurances are going to cover your cleanings, x-rays, exams twice a year. So you got to get your teeth cleaned twice a year. Now, what I find with most of the clients I talk to, if they do not have a dental plan, they're not taking care of their teeth. Many people I talk to are not even getting their teeth cleaned once a year, which is going to lead to overall bad health. Your teeth are going to fall out of your mouth by the time you get to Medicare. By the time you get to 65, 70, you're not going to have any teeth left if you don't take care of them. So regarding dental, all the PPO plans we offer are going to cover 2 cleanings a year with x-rays and the full exam, and that generally will come at zero cost. Now, this particular plan I'm going to talk about today through Mutual of Omaha does have a $100 annual deductible that you have to meet. That doesn't, it is part of getting your teeth cleaned with that deductible. But after that, you get your teeth cleaned, it doesn't cost you an additional penny. Now, to compare the Mutual of Omaha policy I'm talking about to other plans that are on the market to give you kind of an overall picture of what's out there, through the big brand name Delta or Emeritus or United Healthcare, all those plans are going to offer an aggregate amount of coverage. So you got a $1,000, $2,000, like the biggest plans out there are up to $3,000 of annual coverage that you buy into a plan. And then after that, $1,000, $2,000, or $3,000, you're on your own. And that's how all dental works. Now, this Mutual of Omaha policy is a $5,000 annual aggregate plan. I bought it myself to give it some credential that I know what's on the open market and could buy any dental plan that's out there. And I chose this for me and my family about a year and a half ago when we started offering it. It's hands down the best plan out there. Now, to compare Mutual to these other brand names, the $1,000, $2,000, or $3,000 Mutual is $5,000. Those $1,000, $2,000, and $3,000 policies are going to run anywhere from like the high 40s, call it $50 to $75, high 70s. So $50 to $75 a month for that policy, where with Mutual of Omaha, that policy is only $40 a month for a $5,000 aggregate plan. So it's less expensive with a lot more coverage, and there's nothing that compares to it. So it makes it kind of an easy contrast to these other market plans because everybody's looking for savings. Healthcare costs are out of control. Everybody is aware of that. So to save $10 or $20 or $30 a month on a dental plan, a simple dental plan, is real money, and that adds up to hundreds of dollars over the course of the year. Some of these big brand names that I mentioned with the smaller aggregate coverage that we don't offer, they have the big brand name and everybody says, well, I want that policy. Then you look at it and it's not anywhere near as good of coverage as you can get with other types of plans. And specifically, this Mutual of Omaha is hands down the best. So if you're out there looking for new coverage into 2026, especially if you haven't taken care of your teeth, I have people that, I don't suggest this, but people that come to me and say, well, I want to buy a policy. I'm going to spend $40 in, a month for maybe a month or 2 or 3 at the outside and go get my teeth cleaned. So you spend $80, $120 to go get a free teeth clean and make sure that you have coverage in the event that something is wrong. Another thing to consider with these plans is what's called a waiting period. I get questions about waiting period a lot. Now, Mutual of Omaha is also very unique in this regard that if you have a major concern, and define major, we're talking about root canals, crowns, extractions, implants, major type of care. Most plans will not cover the first year any of those major type services. So most plans will cover your cleanings twice a year that first year, some help on the fillings, maybe a simple extraction. But when you go up to root canals, crowns, and major extractions where you're having oral surgery type stuff, most plans don't cover anything in the first 12 months. That's a waiting period. Excuse me. When it comes to Mutual of Omaha, this is very unique as well. It covers 20% of anything major, root canal, crown, in the first 12 months. And after that 12th month, it goes up to 50% of coverage. So if you are coming to an insurance agent saying, I need a root canal and a crown, or I need 3 root canals because my teeth are falling out, most plans are not going to cover anything right up front for the first 12 months on that type of coverage, that type of large coverage. And you have to think about it realistically. What does it cost to do a root canal or a crown? It's hundreds and hundreds and maybe thousands of dollars for a root canal combination. Usually probably a few thousand for a root canal and combo servicing. If you don't have insurance, you're paying out of pocket for that. So even with 20% coverage through Mutual of Omaha, you would be saving money. It financially will benefit you at only $40 a month to come in and have thousands of dollars of work covered at 20% that first year is a financial benefit. I have that discussion with a lot of people. They say, well, if it's not going to cover it all right up front, I don't want to buy it. Well, let's look at the math. Paying $40 a month and you're getting 20% coverage on some major services right up front, it absolutely will save you money by having a dental plan. Your overall health will be better by having a dental plan because you get your teeth cleaned twice a year. It gets you on a program to take care of your oral health, take care of your gums, so that your teeth are not falling out when you're old. I do a lot of work for seniors. I do a lot of Medicare work, and I'm talking to a lot of people, and many of their regrets are, I wish I had taken better care of my teeth. It's very common. I have that conversation with folks in their 70s, 75 that are having problems with their teeth. So if you need help with dental going into the new year, please reach out to us. We'd love to help you. We are here. I want to wish everybody a Merry Christmas if you're still listening to this, and we look forward to serving you.